tingling in your feet, nighttime leg cramps, or that heavy dragging sensation that shows up by evening, if you're a senior, you might chalk these up to just getting older. But they're often early warning signals that your circulation is starting to struggle, and if you ignore them, the consequences can be serious higher risk of blood clots, nerve problems, and even stroke. Now here's the surprising part. What if one single vitamin, not magnesium like everyone keeps talking about, could help support healthier leg circulation naturally? And what if you likely already have it sitting in your kitchen? Over the next 10 minutes, I'm going to break down 5 key warning signs that your leg circulation may already be compromised, plus the one vitamin that may help you turn things around. This is the nutrient many older adults are lacking the most, yet it plays a powerful role in blood flow and circulation. Before we get into it, leave a quick comment with where you're watching from and your age. And make sure you subscribe, because each week I share practical, potentially life-saving health strategies designed to help you stay strong and well after 60. But first, we need to talk about what's really happening inside the body when circulation begins to decline. Because once you understand the why, you'll immediately see why this one vitamin matters so much. Picture your circulation like a network of highways. When traffic moves freely, oxygen and nutrients reach every tissue smoothly, and your legs feel light, warm, and capable. But when that flow slows down, the earliest signs can be subtle, and that's exactly what makes it dangerous. Poor circulation often develops when blood flow becomes sluggish or partially blocked, especially in the lower legs and feet. It can be driven by plaque in the arteries' weakened valves, in the veins, high blood pressure, diabetes, a sedentary lifestyle, or simply the changes that come with age. The biggest problem is that it doesn't usually announce itself loudly. It creeps in quietly, a bit of ankle swelling, toes that feel cold, mild discomfort that comes and goes. Most people dismiss these as normal aging, but they're actually messages your body is sending you. As blood vessels lose their flexibility and blood becomes more likely to stagnate, the risk of clotting can rise sharply. And when circulation is poor, the body struggles to clear waste effectively, which can fuel inflammation, increase infection risk, and accelerate the aging process. Professor Dr. Joel Kessler, a respected voice in regenerative medicine, explains it in simple terms. Healthy blood flow supports every system involved in repair and vitality. When circulation is impaired, the body can't function at its best. The encouraging news is that when you catch circulation problems early, they can often be improved and sometimes even reversed through consistent daily habits and targeted nutrition. And that's exactly what we're doing today. I'm going to guide you through 5 major symptoms that tend to show up in a recognizable progression, each one more concerning than the last. If any of these sound familiar, listen closely, because the vitamin I'm about to reveal is designed to support the underlying issues tied to every single one of them. 1. Changes in skin color. Have you noticed your feet or ankles turning unusually pale, slightly blue, or developing darker, blotchy areas? That's not just a harmless skin change. It often signals that oxygen isn't being delivered properly. When circulation to the lower legs slows down, the skin can shift in color because those tissues are literally being underfed by oxygen. These spots may also feel noticeably cold, and even small cuts or scrapes can take much longer to heal. That slow healing creates the perfect opening for infections. In other words, your body may be warning you that blood isn't reaching the areas that need it most. 2. Cramps while walking or cramps at night. If you get a sudden sharp leg cramp while walking that forces you to stop and rest, it can be a classic sign of intermittent claudication. This happens when narrowed arteries can't deliver enough oxygen to your leg muscles during activity. It may feel like a simple muscle problem, but the deeper issue is often that your arteries are struggling to keep up with demand, and cramps that strike at night can be even more revealing. They interrupt your sleep and often point to the same root cause. Your muscles are essentially signaling distress, asking for more oxygen-rich blood. When that supply falls short, the result can be intense, painful cramping. 3. Frequent tingling and numbness. That pins and needles feeling in your feet, especially after sitting or standing for a while, is easy to dismiss. Many people blame posture-tight shoes or sitting too long. But when it starts happening regularly, it may indicate that your nerves are being strained because they aren't getting steady blood flow. Nerves depend on a constant supply of oxygen and nutrients to work correctly. When that supply drops, tingling and numbness can show up more often. Over time, this can progress into peripheral nerve damage, affecting your reflexes and balance. And that's a serious concern because it can sharply increase your risk of falling. 4 cold feet even on warm days. If your feet feel freezing even when the weather is warm, that's a strong clue that blood is not reaching your extremities the way it should. This typically happens when blood vessels become narrowed or partially blocked, making it harder for oxygen-rich blood to travel all the way down to your toes. I've had patients describe their feet as ice blocks in the middle of summer, to the point that they sleep in socks just to stay comfortable. This is more than a minor annoyance. It can point to arterial issues such as atherosclerosis, and it can also weaken your feet's natural ability to protect themselves from injury and infection. 5. Varicose veins and spider veins. One of the most obvious outward signs of circulation trouble is the appearance of varicose veins. These veins often look bulging and twisted, sometimes bluish or dark, and they can be a clear signal that blood flow is not moving efficiently. They usually develop when the tiny valves inside your veins weaken. When those valves don't close properly, blood can pool in the lower legs instead of moving upward as it should. That pooling can lead to discomfort, swelling, and the heavy dragging sensation that gets worse by the end of the day. Spider veins, the thin red or purple lines that spread like a web, can also be a sign that vein health is compromised. Professor Kessler cautions that a major mistake is assuming these are only cosmetic concerns. Poor venous flow can behave like a quiet, slow unraveling, and once it progresses to a more severe stage, complications become much harder to manage. If you're noticing several of these symptoms, at the same time, I strongly encourage you to speak with a specialist. A simple vascular ultrasound can detect problems early before they turn dangerous. But now, let's talk about the one vitamin that supports the underlying issues connected to all of these warning signs. And if this has been helpful so far, tap the like button. It supports the channel and helps us reach more seniors who truly need this information. Vitamin B3. After 60, the one vitamin that can powerfully support leg circulation is vitamin B3, also known as niacin. You may hear people talk non-stop about magnesium for cramps, but here's the key difference: magnesium can help muscles relax, yet it often doesn't address why circulation is slowing down in the first place. Vitamin B3 targets the deeper problem by helping blood vessels open wider so blood can move more freely, and the risk of clots or blockages can drop. Here's the mechanism. Vitamin B3 stimulates vasodilation, meaning your blood vessels relax and widen. It's like the difference between trying to push water through a bent, kinked hose versus a hose that's fully open. When the pipe opens up, more oxygen and nutrients can reach your legs and feet. That's why people commonly notice less leg fatigue, fewer cramps, warmer feet, reduced numbness, and less of that heavy dragging feeling. Many begin to feel changes within a few weeks once their B3 intake becomes adequate. And B3 does more than improve flow. It also supports heart health by helping lower LDL cholesterol while raising HDL cholesterol. That matters because excess LDL contributes to plaque buildup in arteries, one of the major drivers of poor circulation. By improving the cholesterol balance, vitamin B3 helps keep vessels clearer and more flexible, which is why it connects directly to all 5 warning signs we discussed. Research has linked adequate B3 status with better circulation, lower cardiovascular risk, and fewer symptoms tied to peripheral artery disease. In one study, seniors who raised B3 intake saw a 40% drop in leg cramping and numbness in just 8 weeks. Another study reported better walking distance and less pain in people with intermittent claudication. This isn't guesswork, it's supported by evidence. What many people don't realize is how common B3 deficiency becomes after 60. Yet, it's rarely tested. The symptoms often arrive slowly and get dismissed as normal: aging cold feet, heavy legs, sleep disruption from cramps. But for many, the missing piece is simply low B3 that can be corrected through nutrition. So, where can you get it? Top sources include skinless chicken breast eggs, salmon, tuna, and almonds. A 100-gram portion of chicken breast, roughly the size of a deck of cards, can provide more than half your daily niacin needs. A 3-ounce serving of salmon supplies about 53% of the daily requirement. One large egg gives around 4%, so 2 or 3 eggs at breakfast can add up quickly. A quarter cup of almonds provides about 25%. Tuna, especially yellowfin, is one of the richest choices, with a 3-ounce serving delivering over 90% of daily needs. For adults over 60, the typical target is about 14 to 16 milligrams per day for women and 16 to 18 milligrams for men. If you're already deficient and have symptoms, you may need more at first to rebuild healthy levels. Some circulation-focused studies use therapeutic doses of 100 to 500 milligrams, but only under medical supervision. That's why food should be your first step, and supplements should be discussed with your healthcare provider. If you do use supplements, you might notice the niacin flush at the beginning, a harmless warmth and redness, usually on the face, neck, or chest, often lasting 15 to 30 minutes and fading as your body adapts. That flushing happens because the vessels are widening. If you want to minimize it, a time-release form can help, or you can focus on food sources, which usually cause a much milder effect. A simple day of eating can easily cover your needs. For breakfast, try a 2-egg omelet with spinach and a slice of whole grain toast. Mid-morning, have a quarter cup of almonds. Lunch can be a chicken breast salad with mixed greens and olive oil. For an afternoon, snack tuna on whole grain crackers. Dinner can be grilled salmon with roasted vegetables. With a day like that, you're typically well above 100% of your daily B3+. You'll get circulation-friendly nutrients like protein, healthy fats, and antioxidants. Still, B3 works best when your habits support it. You can't expect ideal circulation if you sit all day, smoke, or rely heavily on processed foods. Small changes add up. Fast move more, even 5 minutes of walking each hour. Drink enough water because dehydration thickens the blood. Cut back on sugar and ultra-processed foods to reduce inflammation. And manage stress, since chronic stress tightens blood vessels. I've seen how powerful this can be in real life. A patient of mine, Margaret, 67, struggled with intense nighttime leg cramps that woke her repeatedly. Her feet stayed cold year-round, even in summer, and her legs felt heavy by afternoon. Magnesium helped slightly, but the problem persisted. When I looked at her diet, she barely ate protein and almost never ate B3-rich foods. She was living on toast cereal and light salads. We added 1 serving of chicken or fish daily and a handful of almonds as a snack. Within 2 weeks, her cramps eased. By week 4, they were nearly gone. By week 8, she had warmer feet, lighter legs, more energy, and she was sleeping through the night again, simply because we corrected a deficiency that had been quietly undermining her circulation. If you don't eat meat or fish, you can still get B3. But it takes more planning. Plant-based options include peanuts, brown rice, whole wheat mushrooms, and nutritional yeast. The absorption can be lower from plant sources, so vegetarians and vegans often need to include B3-rich foods at every meal, and a B-complex supplement may be worth discussing with a provider. Here's the takeaway: leg circulation symptoms aren't harmless nuisances. They can be early alarms for deeper problems affecting your heart, brain, and mobility. But the first step doesn't have to be expensive or extreme. Vitamin B3 niacin supports. Vessel widening improves blood flow to legs and feet, reduces cramping, and numbness helps warm. Cold feet lowers the risk of clots and blockages, and improves cholesterol balance to slow plaque buildup. Start with practical food upgrades. Add chicken breast or salmon. Daily choose almonds instead of packaged snacks. Eat eggs at breakfast instead of only toast or cereal, and include tuna at lunch a few times per week. Many people notice changes in 2 to 4 weeks, and by 8 weeks the difference can feel dramatic. To start today, do 5 things. First, look at what you ate yesterday and today, and estimate whether you're getting B3-rich foods consistently. Second, pick 1 meal today and add a B3 source like eggs at breakfast or chicken in your lunch salad. Third, plan your groceries around chicken breast salmon or tuna eggs and almonds. Fourth, track your symptoms over the next few weeks: cramps, cold feet, tingling, heaviness, fatigue. Fifth, stay consistent, because this is daily nourishment, not a one-time fix. And if you already have symptoms or a family history of circulation problems, talk with your healthcare provider, especially if you take blood thinners or other medications. Protecting circulation protects independence, better blood flow, supports stronger legs, better sleep, more energy, and healthier heart and brain function. Before you go, comment on your age and where you're watching from, and share whether you're dealing with any of these symptoms or have tried boosting vitamin B3. I read every comment and love hearing from you. Before you go, remember this: those leg cramps, cold feet, tingling, and heavy dragging legs aren't just normal aging. They can be early warning signs that your circulation needs attention. And one of the simplest, most practical steps you can start today is making sure you're getting enough vitamin B3 through real food and healthy daily habits. Small changes done consistently can create powerful improvements in just a few weeks. And by 8 weeks, many seniors feel a difference they never thought was possible. Now, I want to hear from you. Comment below with your age and where you're watching from, and tell me which symptom you relate to most: cramps at night, numbness, cold feet, or that heavy feeling by evening. And if you found this helpful, please hit the like button so this video can reach more seniors who truly need it. Most importantly, subscribe to the channel and turn on the notification bell, because every week I share simple science-backed strategies to protect your circulation, strengthen your legs, improve sleep, and help you stay active and independent after 60. See you in the next video.